there! Ready for a wellness adventure? Let's explore the world of health together.
Health insurance plans organize healthcare providers into structured systems known as provider networks. A provider network is a group of doctors, hospitals, clinics, laboratories, pharmacies, and other healthcare professionals that have agreed to work with a specific insurance company under negotiated terms. Government health regulators explained that these agreements define how much providers will be paid for services delivered to insured patients and what rules apply when care is provided. When a healthcare provider signs an agreement with an insurance company, that provider becomes part of the insurer's network. Providers who participate in these agreements are called in-network providers. In-network providers accept the payment terms negotiated with the insurance company. These negotiated rates are usually lower than the provider's standard billed charges. Public health oversight agencies emphasize that these agreements help standardize costs and simplify billing for both insurers and patients. When patients receive care from in-network providers, the insurance plan applies its full set of negotiated benefits. This typically means that the insurer pays its contracted portion of the cost, and the patient pays the remaining share according to the plan's cost-sharing rules. Earlier chapters introduced the concepts of deductibles, copayments, and coinsurance. These cost-sharing mechanisms are usually calculated using the negotiated in-network price rather than the provider's original charge. Out-of-network providers operate differently. These are doctors or medical facilities that do not have a contractual agreement with the insurance company because there is no negotiated payment arrangement. The provider is not required to accept the insurer's reimbursement rate as full payment. Government health consumer protection agencies explain that this situation can create significant differences in cost responsibility for patients. When a patient visits an out-of-network provider, the insurance plan may cover a smaller portion of the cost or may not cover the service at all depending on the plan's design. Even when partial coverage exists, the insurer typically calculates payment using a reference price rather than the provider's billed amount. The patient may then be responsible for the difference between the provider's charge and the insurer's payment. This difference is sometimes referred to as balance billing. Balance billing occurs because out-of-network providers are not bound by the negotiated rates established within the insurer's network. Public health regulators have introduced laws in many regions to limit balance billing in certain situations, particularly for emergency care or when patients unknowingly receive treatment from out-of-network providers within in-network facilities. These consumer protections aim to prevent unexpected medical bills that patients could not reasonably avoid. Provider networks are typically organized around geographic regions. Insurance companies negotiate agreements with healthcare providers located within areas where their members live and work. Government insurance oversight agencies require insurers to maintain networks that provide adequate access to essential services. This requirement is known as network adequacy, and it ensures that insured individuals have reasonable access to primary care physicians, specialists, hospitals, and other medical resources. Network adequacy standards often specify the maximum travel distance or appointment wait time that patients should face when seeking care. For example, regulators may require that primary care providers be available within a certain distance of most plan members. These standards help ensure that network participation does not restrict access to medically necessary care. Another important feature of provider networks involves coordination of care. In-network providers often have established communication channels with the insurance company and with other providers within the network. This coordination helps manage referrals, treatment plans, and administrative procedures more efficiently. Public health authorities note that coordinated care systems can improve treatment outcomes and reduce duplication of medical services. Health plans vary significantly in how they handle network participation. Some plans require members to use in-network providers for most services except emergencies. Other plans allow members to visit out-of-network providers but apply higher cost sharing when they do. Government consumer education programs encourage individuals to review network rules carefully when selecting a health plan because these rules strongly influence overall healthcare costs. Network participation also affects billing procedures. In-network providers typically submit claims directly to the insurance company and accept the negotiated payment structure. This simplifies the administrative process for patients because the insurer and provider handle most of the financial transactions. Out-of-network providers may require patients to pay the full cost up front and later seek reimbursement from the insurer, depending on the plan's policies. Specialists in hospitals are particularly important components of provider networks. Insurers often negotiate contracts with hospitals and specialty clinics that define reimbursement rates for complex procedures and inpatient services. Government health policy institutions explain that hospital contracts represent a major portion of healthcare spending within insurance systems. Negotiated hospital rates therefore play a significant role in controlling overall healthcare costs. Pharmacies and laboratories may also participate in provider networks. Prescription drug networks determine where patients can fill covered medications, while laboratory networks determine where diagnostic tests can be performed under the plan's coverage terms. Regulatory agencies require insurers to disclose these network arrangements so policyholders can identify participating providers before receiving services. Provider networks are dynamic systems that change over time. Contracts between insurers and providers are periodically renegotiated, and providers may join or leave networks depending on the outcome of those negotiations. Government health regulators require insurers to notify members when significant changes occur in network participation, especially if a major hospital or physician group leaves the network. Patients are generally encouraged to verify network participation before receiving non-emergency care. Insurance companies maintain provider directories that list participating physicians, hospitals, and medical facilities. Public consumer protection agencies recommend confirming this information directly with both the insurer and the provider because network status can change. Understanding the difference between in-network and out-of-network providers is essential for navigating the health insurance system effectively. The network structure determines how healthcare services are priced, how claims are processed, and how much patients ultimately pay for treatment. In summary, in-network providers are healthcare professionals and facilities that have contractual agreements with an insurer to deliver services at negotiated rates. Out-of-network providers do not participate in those agreements and therefore may charge higher prices that are not fully covered by the insurance plan. This distinction plays a major role in determining healthcare costs, billing procedures, and access to services within the health insurance system. Provider networks exist because health insurance systems must manage two complex goals at the same time. One goal is ensuring that insured individuals have access to healthcare services when they need them. The other goal is controlling the overall cost of medical care so that insurance premiums remain financially sustainable. Government health policy institutions explain that provider networks are one of the primary mechanisms used to balance these two objectives. At the most basic level, provider networks are created through contractual agreements between insurers and healthcare providers. Insurance companies negotiate payment rates with physicians, hospitals, laboratories, and other medical facilities. These negotiated rates establish how much the insurer will pay for specific services delivered to plan members. Public health regulators note that these agreements allow insurers to standardize pricing across a group of providers rather than paying whatever price each provider independently sets. Without negotiated networks, healthcare pricing would be far less predictable. Hospitals and physicians could charge significantly different amounts for the same service. Insurance companies would have difficulty estimating future claims costs, which could lead to unstable premiums and unpredictable out-of-pocket expenses for patients. Government health economists emphasize that networks create price consistency that helps stabilize insurance markets. Negotiated pricing also benefits healthcare providers. When a provider joins a network, the insurance company directs plan members toward participating providers. This increases patient volume and provides a more predictable stream of insured patients. In exchange for this increased patient flow, providers agree to accept negotiated reimbursement rates that are typically lower than their standard billing charges. Public healthcare regulatory agencies recognize this arrangement as a trade-off between price and patient access. Another reason networks exist is to manage the coordination of medical care. Healthcare often involves multiple professionals working together to diagnose and treat a condition. A patient might begin with a primary care physician, then receive diagnostic testing at a laboratory, and later see a specialist or receive hospital treatment. When these providers operate within the same network, communication between them can be more efficient. Government health agencies explain that coordinated care reduces duplication of tests and improves the continuity of treatment. Provider networks also allow insurers to implement quality standards. Insurance companies evaluate potential network providers based on professional credentials, licensing status, and practice standards. Many insurers review factors such as board certification, patient safety records, and compliance with clinical guidelines before approving a provider for network participation. Public health oversight agencies monitor these processes to ensure that insurers maintain appropriate standards for participating providers. Quality oversight is important because insurance plans must ensure that their members receive care that meets accepted medical standards. Networks therefore serve not only as pricing systems but also as organizational systems for healthcare delivery. When insurers contract with providers who meet established quality criteria, they helped create structured healthcare environments where treatment practices follow recognized guidelines. Provider networks also support cost management through care coordination programs. For example, some networks organize primary care physicians as central coordinators who help patients navigate the healthcare system. These physicians monitor patient health, recommend preventive services, and refer patients to specialists when necessary. Government public health authorities note that coordinated care models often reduce unnecessary hospitalizations and improve long-term health outcomes. Administrative efficiency is another reason networks exist. When providers participate in a network, billing and claims processing follow standardized procedures established by the insurer. Providers understand the documentation requirements, coding systems, and reimbursement processes used by the insurance company. Public insurance regulators emphasize that standardized administrative systems reduce delays and errors in claims processing. Networks also make it possible for insurers to implement utilization management programs. Utilization management refers to processes that evaluate whether certain medical services are appropriate and necessary before they are provided. Examples include prior authorization for complex procedures or review of extended hospital stays. Government health regulators monitor these programs to ensure that they support appropriate care while preventing unnecessary medical spending. Another important function of provider networks is geographic accessibility. Insurance companies must ensure that plan members can reasonably reach healthcare providers within the network. Government regulatory agencies establish network adequacy requirements that specify how many providers must be available within certain geographic areas. These rules ensure that networks provide sufficient access to primary care physicians, specialists, hospitals, and pharmacies. Network adequacy standards may also include limits on appointment wait times. For example, regulators may require that primary care appointments be available within a specific number of days. These standards protect patients from situations in which a plan technically lists many providers but actual access to care is limited. Provider networks also help insurers manage the distribution of healthcare services across different levels of care. Some networks are structured so that primary care physicians serve as the first point of contact for most medical issues. These physicians evaluate symptoms and determine whether specialized treatment is necessary. Public health economists explain that this structure helps prevent overuse of specialized services that may be more expensive. Insurance companies also negotiate separate agreements with hospitals and surgical centers for complex procedures. These agreements define payment rates for surgeries, inpatient stays, and specialized treatments. Because hospital care represents a large portion of healthcare spending, negotiated hospital contracts are central to controlling overall insurance costs. Government healthcare expenditure studies consistently show that hospital pricing plays a major role in determining insurance premiums. Pharmacy networks function in a similar way. Insurance companies negotiate agreements with pharmacies to establish prices for prescription medications. These agreements may include preferred pharmacy networks where patients receive lower cost sharing for filling prescriptions. Government health authorities require insurers to disclose pharmacy network arrangements so that policyholders understand where they can obtain medications under their plan. Provider networks also adapt over time. Healthcare markets change as new hospitals open, medical practices merge, or providers relocate. Insurers regularly renegotiate contracts with providers to update reimbursement rates and maintain adequate network coverage. Government regulatory agencies oversee these negotiations to ensure that network changes do not reduce access to essential healthcare services. The existence of provider networks ultimately reflects the complexity of modern healthcare systems. Medical care involves thousands of providers delivering millions of services each year. Insurance companies must organize these services in a way that maintains affordability while preserving access and quality. Networks provide the structural framework that allows insurers to coordinate healthcare delivery across large populations. In summary, provider networks exist because they create organized systems for managing healthcare costs, coordinating medical care, maintaining quality standards, and ensuring geographic access to providers. Through negotiated contracts, administrative coordination, and regulatory oversight, networks help insurance systems operate in a predictable and sustainable manner while connecting patients with the healthcare services they need. How networks affect costs and access. Provider networks play a major role in determining both how much patients pay for healthcare and how easily they can obtain medical services. Insurance plans use network structures to organize relationships between insurers, healthcare providers, and patients. Government health policy institutions explain that the network model directly influences the financial costs of care as well as the pathways patients must follow to receive treatment. One of the most visible effects of provider networks is the difference in cost between in-network and out-of-network care. When patients visit in-network providers, the insurance company pays according to the negotiated rates established in the provider contract. Because these rates are typically lower than the provider's standard bill charges, the total cost of care is reduced before cost sharing is even calculated. Public health regulators note that this negotiated pricing system is one of the primary tools insurers use to control healthcare spending. The difference in cost becomes more significant when patients use out-of-network providers. Without negotiated agreements, providers may charge their full standard price for services. Insurance plans may still provide partial reimbursement for these services, but the payment is often calculated using a reference price, or usual and customary rate, rather than the provider's billed amount. Government consumer protection agencies explain that the patient may be responsible for paying the remaining balance if the provider's charge exceeds the insurer's reimbursement. This situation can lead to higher out-of-pocket expenses for patients, even when the insurance plan contributes some payment for out-of-network care. The cost-sharing rules are often less favorable. Deductibles for out-of-network services may be higher, and co-insurance percentages may require patients to pay a larger share of the cost. Public health authorities emphasize that these financial differences encourage patients to remain within the provider network whenever possible. Another way networks affect costs involves the calculation of deductibles and out-of-pocket maximums. Many insurance plans maintain separate cost-sharing structures for in-network and out-of-network services. Payments made to in-network providers typically count toward the in-network deductible and the annual out-of-pocket maximum. However, payments made to out-of-network providers may accumulate toward a different deductible or may not apply fully to the in-network out-of-pocket limit. Government regulatory agencies require insurers to disclose these distinctions clearly because they significantly influence financial exposure for patients. Provider networks also affect access to healthcare services. When a patient enrolls in a health plan, the available network determines which doctors, hospitals, and clinics can be accessed under the plan's most favorable cost-sharing conditions. Public health regulators require insurers to maintain networks that include a sufficient number of providers so that plan members can receive necessary care without excessive travel or long waiting periods. Access to primary care physicians is particularly important within provider networks. Primary care providers often serve as the first point of contact for medical concerns and play a central role in preventive care and chronic disease management. Government health agencies explain that adequate access to primary care is associated with improved health outcomes and reduced reliance on emergency services. Specialist access is another key component of network design. Insurance plans must include specialists in areas such as cardiology, oncology, orthopedics, and mental health treatment. When specialists are available within the network, patients can receive specialized care without facing higher out-of-network costs. Regulatory authorities review network adequacy standards to ensure that these specialists are reasonably available to plan members. Hospitals and emergency facilities also play a critical role in network access. Many insurance plans negotiate agreements with major hospital systems in a region. When a hospital participates in a network, patients receiving inpatient care there can benefit from negotiated pricing and coordinated billing processes. Public health regulators emphasize that access to network hospitals is essential for managing high-cost medical services, such as surgeries and emergency treatment. Provider networks can also influence the geographic distribution of healthcare access. Insurance companies must ensure that network providers are located within reasonable distances from the communities they serve. Government oversight agencies often establish guidelines specifying how far patients should have to travel to reach primary care physicians or specialty providers. These rules help prevent situations in which a network technically includes many providers but offers limited practical access for patients living in certain areas. Wait times for appointments are another factor affecting access within provider networks. Regulatory agencies may require insurers to ensure that primary care appointments are available within a certain number of days and that specialist consultations occur within reasonable timeframes. These standards protect patients from excessive delays in receiving necessary care. Network design can also affect the continuity of medical treatment. When patients consistently use providers within the same network, healthcare professionals can share medical records, coordinate treatment plans, and communicate more efficiently. Public health institutions note that coordinated care systems improve patient safety and reduce duplication of diagnostic tests or procedures. Changes in provider networks can also affect access to care. When contracts between insurers and healthcare providers expire or are renegotiated, providers may leave the network. If a physician or a hospital leaves the network, patients may need to find alternative providers or face higher out-of-network costs. Government insurance regulators require insurers to notify plan members when significant network changes occur so patients can adjust their care arrangements. Emergency care is treated differently from other types of services in many insurance systems. Laws in several regions require insurers to cover emergency treatment even if the hospital or physician is outside the network. Public consumer protection laws were developed to prevent patients from delaying urgent treatment due to concerns about network participation. Prescription drug access is also influenced by network design. Many insurance plans create pharmacy networks that determine where medications can be filled under the plan's preferred cost-sharing structure. Patients who use pharmacies outside the network may pay higher prices or may not receive coverage for certain medications. Government health agencies require insurers to provide clear information about pharmacy networks and medication formularies. Laboratories, imaging centers, and diagnostic facilities also participate in provider networks. These services are essential for confirming diagnoses and monitoring medical conditions. Insurance companies negotiate contracts with these facilities to control costs for diagnostic testing. Public health regulators monitor these agreements to ensure that patients maintain access to necessary diagnostic services. Provider networks therefore influence both the financial and logistical aspects of healthcare. They determine which providers are available under favorable cost-sharing conditions and how easily patients can obtain medical services within their plan's coverage structure. Understanding network design helps individuals anticipate both the costs of care and the pathways available for accessing treatment. In summary, provider networks affect healthcare by shaping the relationship between cost and access. In-network services typically provide lower prices and more predictable billing because insurers have negotiated rates with participating providers. Out-of-network services may result in higher patient responsibility and less coordinated billing processes. Through regulatory oversight and structured network design, insurance systems attempt to balance affordability, provider availability, and continuity of care within complex healthcare environments. Thanks for watching World Wellness Care and Coverage.
Thanks for watching! Hope you liked it!